Yeah, varying types of fillings that you can use on teeth. There's tooth color, there's amalgam, which are silver fillings, and there's gold fillings, which are inlays, onlays, things that the lab makes that we cement to place. We haven't done amalgams, the silver fillings, in years. It used to be the standard for the back teeth, and it's still used quite a bit, from what I understand in the country, is for the back teeth, for fillings. It's a decent restoration. Yeah, I've got a mouthful of them. I just don't do them anymore. It's probably been 15 years since I've done an amalgam. In fact, I'd probably have to go back and think about how to do it anymore if I had to do one. But we primarily use the tooth-colored fillings. It's a composite plastic material, essentially. And we use it on the front teeth, obviously, so it blends in. But we use it on the back teeth, too. And those materials have changed dramatically since I got out of school. Everything's changed dramatically since I got out of school. When I got out of dental school, we used those on the front teeth. You'd never use them on the back teeth. They leaked, they didn't hold up. No way would I put them back there. Now it's my restoration of choice. My son had to have his first filling, much to his chagrin, a while back. That's what I put in his mouth, the tooth color filling. We use gold sometimes too. Gold's an excellent restoration. You know, it costs a lot more. It's almost like, a lot more like doing a crown, but it's an excellent restoration. Not something we do a lot of, though. Occasionally patients will request it. The bigger the filling is, the more likely it is we'll talk about it. But then sometimes people are like, well, I don't want gold in my mouth. I don't want that to show. I want porcelain. And you can do porcelain, lab fabricated porcelain fillings too. Porcelain inlays and onlays. Kind of like crowns, but you save a little tooth structure. The more conservative we can keep what we do on the teeth, the better. Saves more good tooth. So, but the tooth color fillings are what we do probably 95% of the time, and they're good and strong. They bond onto the teeth. Folks who have bigger fillings, it helps to strengthen it some. It's kind of the step short of a crown sometimes. Sometimes a crown would be the ideal treatment. For a variety of reasons, patient can't do the crown right now, so we'll do the tooth color filling to try to help strengthen it and hold them for a while too. So, but patients like it because it's tooth colored. Hey, it looks like my tooth. That's a nice side benefit from me, but from my standpoint, I like the fact that it bonds on the teeth, it seals well, and helps strengthen the tooth.